One session that's proved very popular here at the Congress is the overuse of antibiotics in oral health. We've been along to find out more.
I had the good fortune to go to a meeting last June at the White House. At the White House, dentists gets invited to the White House to talk about antimicrobial resistance. It was introduced by the Secretary of Homeland Security for the United States. Oh, I thought they dealt with national security measures, terrorism, guns, violence. They said that this was our biggest threat in the United States, antimicrobial resistance.
Dan, well, thank you very much for joining us.
Oh, thank you. It's my pleasure.
How commonly are antibiotics used in oral health around the world?
Well, they're used quite commonly. In the United States, approximately 10% of the antibiotics that are prescribed by dentists. Around the world, it's difficult to track it. The World Health Organization tries to do it, but a lot of antibiotics are available over the counter where the public can go out and buy them. So it's really hard to keep track of how often they're used.
When antibiotics are overused, what's the impact of that?
Well, the impact is that you're obviously affecting health in some way. And the concern is creating bacterial resistance or a hypersensitivity to the antibiotic.
How does the use of antibiotics by the oral health industry compare with other fields of medicine?
We've worked together with our physician colleagues to develop guidelines. We have guidelines for patients with heart problems or guidelines with orthopedic surgery guidelines. But we need to be doing more, and we need to be working as one team because physicians have their methods of doing it, dentists have theirs, but it's one patient and we need to be addressing what's most appropriate for that patient.
Is there a way that we can measure whether they're being used too much?
Well, that's something we want to do. We have to create surveillance mechanisms not only within our respective countries but internationally as well. And we have to work across other professional boundaries, whether it's with the third-party payers, the insurance industry, governments or regulators, and to collect that information.
So what other options are available to oral health practitioners? How can they avoid using them?
Well, vaccines are a wonderful way, certainly prevention, determining risk, and then behavior, modifying somebody's behavior so they're not putting themselves at risk of disease or infection.
Is there a way that oral health professionals can change their practice as well to help with this?
Practice evolves and science evolves, and certainly we would encourage all providers, whether it's a physician or a dentist or a veterinarian, to update the information that we have on antibiotics. And there's a lot of information available, a lot of research being done. And the important thing is to keep current and then talk to your other providers to make sure that you're consistent with your goals for the patient.
Dan, thank you so much for joining us.
Thank you. It's a pleasure.